Debate that I'm sure many families that are involved in football had at one time. Should we let the little one play football? Specialist in concussions, Dr. Chad Stevens, joining us on the Morning News. What would you say to parents who are concerned, when it comes to hard hits and concussions and letting Junior get involved in a contact sport like that?
I think that those are valid concerns, and I think each parent has to take into consideration what's best for their own child. I think all sports run the risk of contact injuries. I have a sports practice that consists of all different kinds of athletes, and really probably one of my worst concussion sufferers that I currently have the practice is a soccer player who was kicked back in February, and until recently when we were able to get her treated and feeling better, was still feeling the actual spot in her head where she was kicked. And so I think any contact sport runs the risk of head injury, and that needs to be taken into consideration. But the best thing you can do with any sport is to train your kids well and help them understand what's abnormal feelings that they're experiencing, that they need to speak to their coach or their trainer or their doctor about, and even their parent, and also to get them the best equipment you can to protect them.
Concussions are a reality in any sport where kids are running at each other at full speed. But, we've talked about this before on the morning show. It seems that in football, because the kids are wearing so much equipment on them, they might feel that they're invincible and that nothing can hurt them, and maybe they charge and hit a little harder and faster because of the equipment.
That may be true, and it depends on which age of youth we're talking about. If you've had children play, you know that your child has a speed they can run and cut and do things without equipment on, and then you put the equipment on them, including the helmet, and that drops down substantially just because of the heaviness of the equipment and the restriction of the protection gear and things like that. And so I think that depending on the level of play we're talking about, there's different hits that players sustain, and there's different rules that are put in place by different entities that help. But football does run the risk of having more head injuries. We know that it's the number one catastrophic injury sport for boys, whereas cheerleading is for girls, so we do need to take it seriously. But I do think there's an age at which children can play safely and, be protected and enjoy the sport.
Joining us on 710 KURV, specialist in concussions, is Dr. Chad Stevens.
Dr. Stevens, Tim Sullivan here. Can we make helmets any safer? Can technology improve any more to the point that helmets can be made safer to protect from concussions?
Well, I'm not sure there's a concussion-free helmet out there, but there are definitely people that are in the market of trying to find that helmet, because I know recently a helmet was presented that is going to be about $1,500 per helmet, but that it is thought to have significant reduction in impact of each hit. And so in theory that would reduce the amount of concussions a player might sustain if you can cut down the amount of G-force they experience per hit.
Yeah. What's the, I don't know if you know or if there's been any studies, but what's the rate of concussions from, among pro football players as compared to, let's say rugby players who, play a similar game but without protection and therefore probably, as, as Serge was alluding to, aren't hitting as hard as they would be if they, have uniform protection?
Yes, sir. I'm not certain of head-to-head numbers between those two sports, but in just thinking about intellectually the way rugby is played, you would think that the guys would be destroying their lives, from the head down.
Right.
But they do have very specific form tackling skills that they're taught and that they adhere to in rugby. You don't see very many people diving across at 90 degrees in the air to spear another player.
Yeah,
that just doesn't happen, And where in football, whether it's because they feel invincible in their armor or it's because the game has evolved to this and because we fans have promoted it in a way, football has become, the louder, the harder the hit, the more the audience oohs and ahs, and the more, everybody gets excited, and the more you get on Sports Center, et cetera, et cetera. And so I think that's part of the difference in football.
And as we leave you this morning, just a word to mom and dad, what to look for when it comes to a concussion. What are some of the symptoms, something to look for after the soccer game or, I don't know, family game, whatever it is that the kids did and may have come in contact with somebody else?
Sure. Some of them are real obvious, such as the child is just not making any sense or not acting like themselves or just being very withdrawn, whereas they're usually a super outgoing kid. But then the more obvious ones are headache, dizziness, short-term memory loss from before the hit that they sustained. Just balance issues are a big one because of the vestibular challenges that occur in a concussion with the head. And so those are some of the main ones to look for. But like I said, just children feeling withdrawn and not coming out into the brighter lights of your living room or watching a game in the media room that's usually loud, just wanting to be withdrawn and be in their own environment is kind of an indication. And so parents need to educate their kids that, hey, I know you are playing a sport where you could sustain a head injury. If you experience any of these symptoms, you need to feel comfortable to come talk to us about it.
Dr. Stevens, thank you much. Dr. Chad Stevens is a specialist on concussions. Thanks for joining us on 710 KURV.